the term telemedicine is a process of providing healthcare from a distance through technology. And when we think about telepsychiatry, it is a subset of telemedicine where psychiatric care can be delivered either in a live interactive way, kind of like what we're doing right now,
Mhm.
or it can be recorded so that that individual or family member can look at it later. Now, Kathy, I'm going to start with you. Are you familiar with telemedicine and telepsychiatry?
I am. I haven't used either one of them, but I've been offered recently telemedicine because of the COVID stay-at-home orders. Obviously doctors aren't seeing patients in person for, even general practitioners. Most doctors haven't been until recently seeing patients in person, unless it's something that absolutely needs an in-person visit. I needed a refill on a medication, and once you have a certain number of refills, you have to see a doctor before you can get another refill. And so it
Yep.
was actually offered to me. They scheduled a telemedicine appointment with me, and I was kind of looking forward to it to see how it worked. Then they ended up refilling the medication anyway and canceled the appointment. But I thought this is a very good option. One of my neighbors actually uses it quite a lot. She had asked me for a ride. She's an elderly woman. She asked me for a ride to her doctor's office, and we planned on that. We were all set up, ready to go. And half an hour before that, she got a call telling her that they could do it over the telephone instead, her appointment, that she did
Nice.
not need to come in. And I think that we're seeing a lot more usage of telemedicine and telepsychiatry right now. And I'm, due to the stay-at-home order and due to everything else that's going on.
How about you, Dwayne? What's your thoughts?
Well, I have
Having
been
used the service.
telemedicine personally for the past several years, and I have to say it's been a welcome addition to the cadre of supports that I'm able to access. I do a daily check-in, if you will, and if I indicate anything which is outside of normal parameters, I get an immediate phone call, just to, get more information and, make sure everything is okay. And I've even had, some video conferences, and this is all physical health that I've been using. Telepsychiatry is one of the more recent endeavors as a response to the COVID-19 epidemic. And what we're seeing is that our engagement has been increased a great deal, that more individuals are willing and able to communicate remotely with the providers. And we're able to actually do pretty good risk assessments and provide resources and information remotely. And what we have decided is we will have a hybrid system of both in-person and telehealth services going forward.
And Dwayne, how does this service, I know you have experience with, telemedicine, how does it compare to your face-to-face interactions?
It's so interesting. I had a telehealth conference with one of my medical providers last week, and it was interesting that I actually spent more time speaking with him virtually than I would usually do on an in-person visit. It's like he had more time to
Mhm.
actually engage with me, and I was on speakerphone, so my wife was able to contribute. And I kept thinking to myself, why was I going to his office all this time when, we could just do it virtually? But yeah, it's made a huge difference. And it's something which I think the industry is going to continue going forward.
Yes,
Oh, I hope
and
so. Sorry, go ahead, Becky.
absolutely. Yeah, so absolutely. And I also want to highlight too, that American Psychiatric Association has declared telepsychiatry as a core tool of daily clinical practice.
To your point on that, Becky, before you get into the next slide, I'm curious, is CMS covering Medicare and Medicaid? Are they covering telepsychiatry? Are they
From my,
continuing on with that? Do you know?
from my understanding, I can only speak to New Jersey, and maybe Dwayne can provide some perspective for New York. And also in Philadelphia, they are allowing Medicaid patients who use telepsychiatry, and they have expanded telemedicine due to the recent pandemic. And I think with the recent pandemic, there has been an uptake in regards to the use of digital services right now. Dwayne, you want to comment on that?
In New York, I think there is some marked differences between what's considered a billable service, depending on which insurance reimbursement is being billed. So we're still trying to work out some of the kinks in terms of whether a voice session is billable under Medicare regulations. For Medicaid, I think it's less stringent because it's more local, the decisions which are being made. So there are some challenges, but I think industry-wide, it's being more accepted, and they're trying to come up with, more flexible ways to provide telehealth.
That's great. I hope so. I hope that we can continue forward with this because, like you mentioned, Dwayne, you're finding better outcomes from the people, the clients that you're connecting with. You're finding better outcome for your own usage of telemedicine with your doctor. He spends more time with you. So I hope that going forward, this is something positive that can come out of the necessity during the COVID-19 crisis, and that we can get providers properly compensated for providing this.
Mhm.
So in the next slide, and actually in the next two slides, we basically cover some of these items. And right now, telepsychiatry can be offered with some service flexibility in some setting. Obviously, the whole age spectrum now with telemedicine, you can offer that service. And in special cases like individuals within correctional facility, military personnel, it can also be adapted to that individual schedule, or even for certain minority or ethnic population, we can now maybe connect those individuals who might speak like Russian, we mentioned earlier, to a Russian provider, so that we can build the gap and build the bridge and maybe take down some of those barriers. And telepsychiatry service can also be provided in multiple settings, like the emergency room services, hospitals, schools, assisted living facilities, and even at the comfort of the patient's home, which is very important due to our current situation and time. And telepsychiatry have the potential to reach many individuals in different settings, and use of digital technology may help with streamlining some of the delivery of various interventions. So, Dwayne, what are your thoughts about mental health intervention services being delivered through digital technology?
As I mentioned before, one of the advantages that um, telehealth has provided is allowed an increase in the engagement that we have with individuals. And we are still able to do the risk assessments, which is a necessary component of our interventions and supports. Um, I think it's been effective so far, but it does require that individuals have a certain level of proficiency and comfort using the different telehealth modules and platforms. We were thrust into this pandemic situation with social distancing being enforced, and we had to immediately make sure that the individuals in our service had both the resources and the knowledge to be able to access telehealth supports.
So, Kathy, a different question than Dwayne. Which services do you think would be most appropriate for telepsychiatry, and which service may not work quite as well for telepsychiatry? Can you speak on that?
Yeah, that's a really good question, Becky. I think that for most services, telepsychiatry could work. For med management, for a patient who's basically stabilized and just needs refills or maybe adjustments to the meds, I think that can be done. I think psychotherapy, counseling, substance abuse issues, all of those I think could be very effective. To your point about what wouldn't be effective, I would say if a patient has severe paranoia, it probably would not be the best way to offer the treatment. Um, it depends, of course. If the person has chronic paranoia and maybe understands their illness, they would be more open to it. But if they're in crisis and paranoia is part of that, or probably any patient who's in crisis, it would be difficult to put technology in front of them and have them engage with someone there. I think with crisis contacts, you have to have human beings face to face in real life, not technology. But
Wait,
once it's de-escalated, it would be possible to then get the therapist on FaceTime or something to talk further with the client. But in the initial crisis, I'd say no, just in my opinion.
You know, Kathy, you make a good point. You know, I was mentioning how we've been able to do risk assessments virtually, but at the end of the day, it does require that there is an in-person support and evaluation. All we're able to do is assess, you know, the level of risk that someone may be exposed to at any given time by what they are expressing or by what, if they're using any video platform, you know, the way that they're, you know, expressing themselves, and we can visually see that there's some distress, but we still have to have that in-person intervention. And once they are in a more, you know, stable and engaging place, then we can switch to a more virtual interaction.
Yeah, I think nothing's ever going to fully replace the human contact
Mhm.
involved in helping other human beings. But telehealth definitely has a very good place in providing support and interventions and management to someone. So yeah, thank you for those comments, Dwayne.